Pressure ulcers, also known as pressure sores or bed sores, can cause a great deal of pain and discomfort. They are caused by pressure when you are sitting or lying in the same position for too long, and pain is often the first sign that something is wrong. Pressure ulcers can happen to anyone. For example, you may have experienced the discomfort from pressure when travelling on a long journey and your bottom feels numb, or when you wear new shoes and develop blisters on your heels. Pressure ulcers can begin quickly if pressure is not relieved. It is estimated that just under 500,000 people in the UK will develop at least one pressure ulcer in any given year. Pressure ulcers are more likely to happen to people with an underlying health condition who are immobile or who are unable to move themselves. Within this easy step-by-step guide, we are going to help you understand how pressure ulcers can develop and how we can help you to prevent them from happening and stop the pressure. Chapter 1. Who is at risk? So who is at risk? Although older people have a greater risk of developing a pressure ulcer because of different health conditions, remember they can happen to anyone. You're at risk of developing a pressure ulcer if you suffer with a health condition that affects your ability to move, if you have a physical disability, or have suffered with paralysis, multiple sclerosis, a stroke, or dementia. Your short-term mobility may also be affected after an operation. But don't worry, pressure ulcers can usually be prevented, and we're going to tell you how. You are also at risk of developing a pressure ulcer if you are sitting or lying for long periods without moving and do not eat and drink adequately. Chapter 2. Where can pressure ulcers develop? If you're a bedbound patient or looking after someone who is, the most likely places for pressure ulcers to develop are the buttocks, elbows, ears, spine, shoulders, heels, hips, the back of your head, your toes and tailbone. Remember those vulnerable areas of the body by thinking of best shot. If you are a wheelchair user or sit in an armchair, you are more at risk of developing pressure ulcers on your hip bones, buttocks and heels. Chapter 3. How do pressure ulcers develop? Pressure ulcers can begin to develop in a few hours and will become worse over a number of days if pressure is not relieved. When pressure is against your skin from a surface such as a bed, chair, or even new shoes, the surface presses against your skin and squashes the skin surface, as well as the deeper tissues closer to the bone. Blood vessels normally run through your skin, keeping it healthy with oxygen and nutrients. When those blood vessels are squashed by pressure for too long, they can no longer keep that part of your skin healthy, and a pressure ulcer will begin to develop. The beginning of a pressure ulcer can be seen as a red or inflamed area on the skin. You're likely to experience some discomfort at this point, or a feeling of numbness, which is a warning sign that something is wrong. Chapter 4. How do I know if I have a pressure ulcer? If the area is painful and does not turn white when pressed but remains red, you have developed a stage 1 pressure ulcer. These are early warning signs, and you need to report it to your carer, nurse, or doctor, who will provide you with the right advice. The best way to test an area of skin for a pressure ulcer is to look at your skin and carry out a skin test. If you see any reddened areas over the bony parts of your body, you can lightly press the area with your finger and count to 15. When you remove your finger, the area that you have pressed should now be white or blanching. This means your skin remains healthy. If you have dark skin, it is unlikely that you will see the redness or the blanching, so be aware of pain or purple discoloration across the bone. Chapter 5. How serious can a pressure ulcer be? There are 4 stages of pressure ulcers, and it's important you're aware of each stage and understand that if left untreated, they can become more severe. Pressure ulcers are painful and can take weeks or months to heal, so it's best to stop them in the first place. Stage 1 pressure ulcers are often discoloured and do not turn white when pressure is placed on the skin. These may hurt or itch and tend to feel warm or spongy. This stage can be prevented from getting worse, but must be managed as soon as possible. In stage 2 pressure ulcers, the outer surface of the skin and part of the second layer of skin is damaged, leading to skin loss. The ulcer looks like an open wound or a blister. This can happen from prolonged pressure, but may also happen if you drag your skin across the bed or chair. In stage 3 pressure ulcers, skin loss occurs throughout the entire thickness of the skin. The underlying tissue is also damaged. However, the underlying muscle and bone are not damaged. The ulcer appears as a shallow or deep cavity-like wound, in other words, a hole in your skin. Stage 4 pressure ulcers are severe. The skin will be badly damaged and the surrounding tissue begins to die. The muscles or bone could also be at risk of damage. Stage 4 pressure ulcers can lead to life-threatening infection, so it's important that you get them treated as soon as you notice the first symptoms. If you are at very high risk or suffer with a stage 3 or stage 4 pressure ulcer, you may need a higher level support surface that creates movement. Chapter 6. How do you stop pressure ulcers from happening? So, how can we help you prevent pressure ulcers from developing? Your community nurse or carer can assess your individual circumstances and will take into account your ability to recognise pain and your ability to move. Your diet, continence state, and blood circulation will also be assessed. They can help create a plan of care specifically to meet your needs. An easy way to remember the 5-point action is to think skin. S is for support surface. A support surface is a special mattress, cushion, or heel protector that will relieve pressure. There's a range of support surfaces available to meet your needs. Your community nurse or tissue viability nurse will assess your need and order the mattress and cushion required. Memory foam is a special foam that conforms to the shape of your body and spreads the pressure. If you are not mobile and sitting for long periods of time, your heels and bottom are at particularly high risk from pressure damage, and keeping the pressure off is very important. Remember that if you are wearing the heel protectors, you must not walk in them and can take them off easily by loosening the Velcro straps. If you are at very high risk or suffer with a stage 3 or stage 4 pressure ulcer, you may need a higher level support surface that creates movement. The second S of skin stands for skin assessment. To prevent pressure ulcers, it is important that your skin is assessed regularly. You may be able to do this yourself with the help of a mirror. Alternatively, your carer or nurse should assess your skin. If you notice any changes to your skin or any redness, you must tell your carer, your nurse, or contact your GP. The K stands for keep moving. If you cannot walk independently, you will be at risk of developing pressure ulcers. Regularly moving is the best way to stop pressure ulcers from developing. This may be difficult, but standing for 2 minutes every hour or changing position while in your chair or lying in bed reduces the pressure on any vulnerable areas. You will need to keep moving even when you have the right support surface. If you are a wheelchair user, you are advised to keep regularly moving to take the pressure off your bottom and lower back. This may be achieved by lifting yourself up for a few moments, or you may need assistance with lying on your bed for an hour or 2. If you are bedbound, you should change your position regularly during the day. If you struggle to change position yourself, a carer or relative should assist you to ensure the pressure is relieved. The I in skin stands for incontinence. If you suffer from bladder or bowel problems, you may experience wetness on your skin from urine or loose stool. It is important to keep skin clean and dry. Wet or soiled skin can become weak and less resistant to pressure. A continence pad will help to keep your skin dry, but if your skin does become wet or soiled, it should be cleansed with water and an allergy-free soap, and then gently patted dry. If you are wearing a pad, do not use a barrier cream because this will prevent the pad from absorbing the wetness. It is advised that you do not use talcum powder or perfumed products such as perfumed soaps and bubble bath, which can irritate your skin. Finally, the N in skin stands for nutrition. Eating a healthy, well-balanced diet and drinking at least 8 cups of fluid a day will help to prevent pressure ulcers from developing. Protein and vitamins are part of a balanced diet and keep your skin healthy. If you do have a pressure ulcer, they also help with the healing process. If you are suffering with weight loss or a low appetite, your GP may refer you to a dietitian to create the best plan for you. Prevention is better than cure, so take action now. Regularly look at your skin and be aware of any sign of pressure damage, keep the pressure off, and if any changes in your skin appear, inform your carer, nurse or GP. If in doubt, check it out. The Nottingham CityCare Tissue Viability Service is available to offer advice on both the prevention and treatment of pressure ulcers. We hope this film has helped you to understand how pressure ulcers develop and what can be done to prevent them. If you have any more questions, please don't hesitate to ask a member of our team or go to the CityCare website. Or you can make a referral by telephone on 0300 300 3333.
In December 2010, I was caught out one weekend with septicemia, went into hospital and was immediately on a life support machine for 3 months. And obviously during that period, I wasn't able to be moved very much. And accordingly, the pressure sore must have developed during that time. I was in a self-induced coma, so it obviously meant that I was heavier and more difficult to move. Shortly after that, I went into, I think it was another ward where Alison became involved with my case, and it was a really nasty open wound.
I actually got pressure ulcers in 2 stages, really. I got some in my feet, which occurred approximately 4 years ago, and then due to a bone infection, I got one on my left buttock, which would have been about 1.5 to 2 years ago, I suppose. The ones in my feet occurred, we believe, through pressure, as in weight through my legs into my feet onto the pressure plates. But the one on my left cheek was caused through tracking out from the bone infection I had.
I was in hospital a total of 9 months, and nobody in that period was able to help or rectify the thing. Certainly I had help from tissue viability, but there was no great improvement because I was lying down for such a long time. So the extensive effort to improve my situation could only start after I came out of hospital in around about July, August 2011. And pretty well, I think it's correct to say that Alison was seeing me maybe almost weekly, and to try and start the process of the wound being healed. But it got to a point where no further improvement was being experienced, and I was put on a vac machine for a very long time. I think 1.5 years. I had this machine on my shoulder, around my waist, to try and improve the condition of the wound. It got to a point probably about a year and a half ago where there wasn't any further improvement from the vac, so I was taken off the machine, and discussions were started as to whether or not surgery could be considered.
The ones on my feet, which was on left and right foot, became quite infected, and then eventually it went down to the bone, which took a long period of time to then rebuild itself, as in repair itself outwards. And the one on my cheek was a good about 6 inches deep, with a big sort of cavity at the end of it. And it was the cavity which took time to... Well, I had to have an operation, which they drained and healed, and again spent a good 2-3 months basically laying on your front in the bed just to try and repair it. And now, even now, I still have to be very conscious of the fact of releasing any pressure. So I spend predominantly quite a fair bit of time resting, which again, as previously said, it hinders your ability to go out and about, really.
First of all, I'm constantly uncomfortable. I'm at times in great pain. Right now, I'm sitting here, but I'm very uncomfortable. I don't know if you can see it, but I'm sitting on a special cushion, which I have to use whatever I do, wherever I go, whether it be a car, people's homes, flying somewhere. I have to use it because if I don't, the condition worsens and the discomfort increases. So my life is really seriously affected by it. Imagine carrying a vacuum machine around with you on the side of your body or carrying it over your shoulder. The noise, people always asking you why, what, how, and you know very well that it's the only possible opportunity to improve your health situation. So my life is pretty bad at that.
When I first came out of hospital, you was told about pressure sores and to be careful of them, but you didn't really, I would say, take much notice, but it was sort of, it won't happen to me. But of course, when it does happen to you, it left me, as I say, in bed for approximately 20 hours per day, which meant that, because I was working at the time, so my work commitments had to cease. Family activities were reduced, because obviously you couldn't go out and about because you was predominantly on bed rest, really.